Good afternoon, everyone, and welcome back to the Brainy Boomers lecture series. We're very happy that you joined us today. So the MCSA Education Committee, which was founded in 1996, has three objectives. The first, identifying education needs of mental health care providers, seniors, caregivers, the public, and developing responses to meet some of these needs. The second, enhancing the positive image of the aging process by addressing stereotypes and myths about aging. And third, dissemination of research on aging. So today's guest is Dr. Christine Roy. She graduated in medicine from the University of Sherbrooke in 1990. Dr. Roy practiced for 30 years in family medicine, including emergency hospitalization, home care, and monitoring of a multi-age patient population. In 2019, after completing training with the Royal College of Irish Physicians, Dr. Roy established herself as a full-time medical consultant for the Société de l'Assurance Automobile du Québec Road Safety Research and Development Department. Before continuing, we would like to remind you to please mute your microphone. And if you have any questions, you can write them in the chat box below. And so for this presentation, if you have earphones, we would encourage you to use them. So now I would like to invite our speaker, Dr. Roy, to start her presentation.
Hi, everybody. I'll share my screen. Thank you for inviting me. Can you see my screen, the PowerPoint?
Yes, we see it.
Okay, so let's start. Now the question, should I stop driving? Yes, no, maybe if I'm 80, 85, 60, 20, when should I stop driving? That's what we're gonna try to answer together. Disclosure of conflict of interest, none except road security. Here are some facts that about us driving and aging. As you see, the number of aging driver and aging here is 65 years and older are increasing. And as you can see, we still have some drivers that are 90 years old and they can still drive safely. How can they can manage it? And should they still be driving? That's what we'll address. Some facts. Drivers over age 65 or older are accounted for 22% of all driver's license holders in Quebec, and this proportion is growing rapidly. Each year, an average from 2017 and 2021, drivers age 65 or older accounted for only 12% of drivers involved in crashes with personal injury. But because of our greatest physiological vulnerability, I'm sorry, my German Shepherd dog is telling me that the postman is coming. So I'm sorry, she's pretty loud. So when you're 65 years and older, well, you have usually most often you can have some medical problem. Let's say you can have some medication that will, let's say like blood thinner, that will make an accident have really bad consequences. Okay, so that's why when you get older and you get in a car accident, the risk of being killed or having very severe injuries is not related to the age per se, but because of the medical condition and the medication we're using. Okay, when do we get the accidents? When we drive and we are 65 years and older. It's usually during the morning, the afternoon, during the week. Usually the accidents occurs urban areas on a road where the speed limit is 50 km or less. Parking lots, you could say 27%, and at intersections. What does it tells me? It tells me, well, seniors are good drivers, but with aging, our body and mind will change, and we need to address this change with our driving. Okay, what we know, if you drive less than 3,000 kilometers a year, well, you're more at risk to have a road accident. Okay, and the accidents will occur really 5 km just from your home. Seniors drivers wear their seatbelt more, they self-regulate, but still, we find all those drivers having problems with distracted driving, reckless, inappropriate behaviors. And when we look at the driver's record, we see that senior drivers will have a little more difficulty with the left turn, overtaking, stopping at a 4 intersection, yielding the right of way. Seniors on road safety rules, even with several years of driving under your belt, you need to pay close attention to road safety rules and signage. So maybe you can have some driving lessons. A little refreshment is always good. Driving schools can assess the way you drive and help you adopt or re-adopt good practice. Again, it's not the age, but driving is complex. Driving is complex for everyone. Having good vision, good health, good reflexes. This is the rule that applies to everyone, young and old alike. It's not the driver's age that will determine the ability to drive, but it's really the state of health. What do I mean by state of health for driving? I will answer it in the next slide. Sure, if you have some disease like epilepsy, Parkinson, diabetes, this is known to increase the risk of accidents. But if you're under medical supervision, you're taking good care of your problems, well, it means that you probably are going to be a safe driver. Remember, any medical condition can have an impact on driving on a road vehicle. Let's say you're going for an ear infection and you feel dizzy. Well, the ear infection and the dizziness will prevent you for riding back in your home to your home in your own car, but for only a couple of days. But if you have a serious medical condition that would evolve, let's say Parkinson, well, you need to address early the driving. Seniors in Quebec, they're pretty active. They say that they feel good, they feel in shape, but when you look into their medical file, they do have a medical condition that can affect driving. Medication. You have to be very, very extra careful because some medication can affect alertness, vision, coordination of movements and behavior. Before you get behind the wheel, it's best to make sure that it's safe to do so. And usually the risk is higher when you start to introduce the medication the first times you take it, and when you reduce the medication, when you switch to another medication. So have this discussion with your pharmacist and your doctor or nurse practitioner. They will really help you to adjust medication and driving, and beware of the mix. Medicine don't always coexist well, especially with over-the-counter medication and especially with alcohol or any other drugs. Okay. And stopping the medication does not mean stopping the dangers for driving, because if you take your medication for diabetes and your blood sugar is well controlled, then you're safe to drive. Well, it's a law. What's the law say? It means the regulation respecting the health of drivers, or en français, le règlement relatif à la santé des conducteurs, describe the medical norms that we need to apply to make sure that we're fit to drive on our road in Quebec. The same medical norms applies in Canada. The most common conditions include eye problems, cardiovascular disease, cognitive disorders, and epilepsy and diabetes. So it's really the law. In Quebec, all drivers must meet certain requirements with regard to their vision and state of health. They also require to notify La SAC of any change that will impact their driving. So at age 75, we will screen, like population screen, by sending you the self-declaration form that you must return at 75. This is kind of new. It's been there for the end of 2021. So when you receive this form at 75, you must declare, you must self-declare your medical information, and we will analyze it. And then you might have to send us back a medical report or a vision report. But at 80 and every 2 years thereafter, you must send us back the medical examination report and a visual examination report. We analyze that one by one, and we will make a decision about the license. What does it mean to be in good health for licensing, for driving? It means having a good eyesight. I mean, the vast majority of information required to drive safely passes through the eyes. But so if you need to wear glasses for driving. If you've been if you're follow up by your optometrist and tells you not to drive during the night because of the blurriness, because of a cataract that is starting to grow, then you respect and you don't drive during the night. Being able to easily move all parts of your body. So I always try when I'll read a medical chart, a medical exam report from your doctor, I'll try to in my mind, I'm trying to figure out how this person will get into the car, buckle up, be able to use the steering wheel with both hands, and be able to react quickly to any security problem that would come on the road. So being able to easily move all parts of your body, your neck, your shoulder, your hands, your feet, being able to turn and check the blind spot, back up, park, good reflexes, for example, being able to brake quickly, and being able to process also a lot of information at a time. I mean, slowing down, changing lanes, blind spot checking. Whoops, there's someone walking. Whoop, there's a bike on the other side. Sun is kind of blurring in my eyes. So this is all the things you have to do when you're driving, and it's constantly everything changes constantly. It's never the same drive that you're making. So as the time goes by, even a skilled driver may lose some abilities without noticing. We age, and our body, our mind, our eyes will change also. So we have to address it. Even if we're in good health, we have many years of driving experience, certain health problems and vision problems will appear with age. That's what I said. So what the medical examination allows us to check your general state of health, your mobility, range of motion, especially when you turn your head, your cognitive function, your behavior, your memory, your attention. What the vision test allows us to check while your distance and peripheral side vision, any blind spot that you could have, any problem that can reduce your ability to drive safely, such as cataracts, glaucoma, macular degeneration. Don't worry. Very few people will undergo a medical examination or the visual examination and will lose the license. It's between 2 and 3%, but most of the drivers will have some condition to respect on their license. I would like avoiding driving at night, having to wear eyeglasses, or having to send back a report, a follow-up report in 1 or 2 years, depending of the medical condition that you have. Okay. Some medical condition also are linked to adaptation of your car. So this is also important. That was something kind of easy to think about. You have a lot of arthritis or arthrosis in your hands. You have the strength is getting weaker, the grip weaker, but something easy as a kind of a ball you can have install on your steering wheel will make you grip safer, so you can drive longer. These kind of adaptation you can talk about with your nurse, your doctor, or occupational therapist. Questionnaire you can ask yourself, or your family allies around you could also ask themselves, are your movements limited when you are on the wheel? Are you confused when you merge onto a road or exit the road? Do you remember the route you usually take? Do you stop at intersections at the last moment? Do you need the help of a passenger to drive a GPS, a human GPS? Do you have difficulty yielding the right of way? Do you have difficulty performing certain maneuvers, just as backing up? I used to screen one of my old lady. She was 92 years, and I said, every 2 years she would come with this form. And I said, how can I make sure that she's a safe driver? And I would ask her, do you always take the same road when you come to visit me at my office? She said, why should I take the same road? Depending on the traffic, I won't take the same road. Okay, how do you park? Do you always park? Do you back up when you park? You come to our office, or you always park in front? I said, it depends on the place I have between the two cars. I will back up or I will face. So I was really reassured because she was not restricted in her driving. She would apply the type of driving she needed to the situation. Do you have difficulty reading, understanding traffic signs? Do other drivers regularly honk at you or try to get your attention? That's not a good sign. Have friends or family members make comments on your driving? You should listen. Do some people hesitate or refuse to get in a vehicle that you're driving? That's a red flag. Are you more often involved in fender benders? Well, all these questions, if you did answer yes, well, you should address the driving. You should address health status and driving. Consult your physician, your nurse practitioner. Address the driving sooner than later. Refresh your knowledge or review your driving techniques. Think about other way of getting around mobility plan. Okay. Adapt the driving to your abilities. Here's some advice to drive safely. Well, you can plan longer rest periods during long trips. Choose routes that you're familiar with, but you need to have the capacities to take and drive other routes also. Choose a car that makes driving easier. For example, a car that a newest car, a new brand of car will have some kind of adaptation that will help for the driving also. Wait for rush hour to end before going out, and avoid driving at night, poor weather, if you feel unwell or tired, if medication has been changed or you're not sure of the side effects of the medication yet, and never drive with alcohol or medicinal cannabis or any other drug. Advice on staying in shape and staying behind the wheel. As long as you're in shape, good health, you're taking care of yourself, taking care of your brain, you'll be able to drive safer, longer, and be a safe driver. So see your physician, see your medical provider, take your medication if you need to correctly, exercise, eat well, watch your weight, continue to challenge your brain by reading, doing crossword, by learning. That will make you a good driver. Your loved one can help you. Your loved one are your best allies too. They will open the dialogue with you, and they will give you some feedback about your driving. And when they're concerned, I am concerned as a medical physician, and when the family is concerned. And in the literature, we see that there's a risk of accident when the loved one are concerned about the driving. They can inform us if they're concerned, and that will usually will analyze what they told us, and we could send you a medical report or a vision report to have to be filled out. Okay. Retirement from driving, it should be in your retirement plan, but it isn't in Quebec. We forget that we will retire from driving, and we see women will retire earlier than men. And what I see is women could travel safer longer, but they'll more anxious, have less experience, so they trying to quit earlier than the men. Few Quebecers plan their retirement with the cessation of driving in mind. So if you're not used to walk, to bike in your 60s, it's going to be harder to learn and to do and change this in your 70s, and even worse in your 80s. So, and when you stop driving and it's the only way you get around, well, it's gonna have some pretty bad side effects if you don't address this before. So you'll have difficulty access the healthcare, mental, physical health problems if you didn't try to arrange a mobility plan. we have a lot of information on our website. This slide will tell you how to get into our website, and I think it's good for you to read about. Lots of other publication of interest, and you have more, and I think really my message is not the age, it's really the medical condition that will impact your driving. It has to be addressed. It sometimes can be corrected, but sometimes, well, if eventually we are gonna stop driving, even if we don't have medical condition, because we will be too tired to drive, our brain will be too slow, so we'll need to retire from driving, and it's going to occur earlier if we have a medical problem. Thank you.